Thank you, Madam Speaker. Hospitals are a lifeline in our communities. As the daughter of a pulmonologist and critical care specialist and someone who spent more than 30 years working in hospitals and healthcare systems myself, I know all too well the essential role hospitals play in our communities when it comes to health and wellness. But equally important, and something we don't often consider, is the social and economic stability they represent as they seek to address social determinants of health and serve as major employers. Unfortunately, there are many parts of our state where access to health care is limited at best, places where preventive health care is a luxury. Across our Commonwealth, there is a growing number of healthcare deserts, and this is due to the steady increase of health system consolidations and closures. The results can be devastating. Fewer healthcare choices and cost increases for patients, the stifled ability for healthcare professionals and staff to negotiate better wages, and in extreme cases, closures often after private equity firms buy up health systems and strip them of their assets. A staggering 14 of the last 15 hospital closures in the last 5 years in Pennsylvania occurred following a merger or acquisition. Crozier Health System, Hahnemann Hospital, Elwood City Hospital, Bucktail Medical Center, and Sharon Regional Medical Center are all examples from the last few years of private equity owners leaving hospitals to collapse and leaving communities behind. Right now, our Attorney General has some ability to review sales involving nonprofit health facilities, but it is limited. Today, we consider House Bill 2344, which strengthens oversight by the Attorney General over hospital acquisitions and consolidations. It provides a mechanism to allow the Attorney General to determine if the transaction is in the best interest of the community. These provisions would now require health systems to file timely notice and relevant documentation. It gives the Attorney General the authority to seek legally binding agreements from merging health systems to preserve health services rather than unenforceable promises that are typically announced with mergers. It allows the Attorney General to block leveraged buyouts and other Wall Street financial tricks to raid hospitals of their assets and leave them with massive debt. My colleagues in Delaware County have seen this happen in real time. It allows the Attorney General to challenge large shareholder dividend payments to hospital owners when such payments threaten the financial viability of a health system. It also allows the Attorney General to vet the finances of an acquiring entity to ensure that they have the financial strength to run a successful health system in the long run. This bill also includes many revisions which demonstrate a considered effort to do no harm. Removing the financial penalties, changing the cost sharing, increasing the implementation timeline, and changing the financial threshold for review represent a considered collaboration between my colleagues and many stakeholders. Healthcare delivery in Pennsylvania is in crisis. This bill is designed to keep bad actors from further decimating a weakened system. I look forward to working with my colleagues to continue to address some of the systemic issues which force hospitals into situations where mergers or consolidations become a last resort. Our hospitals and our providers need to address rising costs and decrease reimbursements, the growing number of uninsured and underinsured, and the issue of uncompensated care, which is severely impacting some of our most important safety net hospitals in urban, suburban, and rural communities. I urge my colleagues to join me and my co-prime, Representative Takak, in supporting House Bill 2344 and help take an important step in protecting and preserving health care access in our Commonwealth. Thank you, Madam Speaker.
Clerk will record the vote on final passage of the bill. The yeas are 114. The nays are 88. The majority required by the Constitution having voted in the affirmative, bill passes the House finally, and the clerk will present the same information to the Senate.